Hi everyone, my name is Sarah Erdelyi. I'm one of the instructors in the medical radiography program. I'm sorry I couldn't be there today to participate in person, but I was really excited about this event and I still wanted to be able to contribute to the day. So what I thought I would share to get things started for you is my first impression of the building design and highlights from my first term in the Center for Health and Wellness. So in one of the very first architectural drawings of the building, I noticed the social stairs right away. I thought it was very eye-catching. This is not the actual photo that I first saw, but it's the only one that I could find. So many others probably also cited this as one of the features that stood out for them. And at first glance, I thought this was just a cool design feature, and I could imagine students hanging out in the space. But then I spotted the podium on the drawing that I saw, and immediately I had this idea to present one of my lectures at this podium and invite students from other programs to attend. I had a specific course in mind, one of the courses called Clinical Preparation in the Medical Radiography program. And this course is all about preparing students for the reality of their first clinical, as well as teaching them about the expectations of a health professional. This is a topic that I think all HHS students can relate to. We all must uphold a code of ethics in how we interact with and serve the public. So I thought it would be a really neat idea to invite students from other programs to learn about issues that medical radiography students potentially might face in the medical imaging setting and have an open discussion. I've yet to follow through on this idea because I ended up changing my teaching assignment for the fall of 2019 and I wasn't teaching that particular course. However, I still have dreams of doing this, and at some point when the timing and the topic is right, you may just see me out there doing a lecture with an open invitation. So the rest of the few minutes that I'll spend chatting with you, I'm going to speak about the X-ray labs because this is where I spend the majority of my time. In fact, I spend 16 hours a week in the fall term in these little rooms back in that first level corner of the building. So the X-ray labs, to me, are arguably the most critical space for learning in our medical radiography program outside of clinical practicum. I'll admit that when I first saw the layout of the new labs, I was concerned about lack of privacy and noise. However, this seems to be a quieter end of the building. Also within the labs, there's more than enough space that having two instructors working with groups of students simultaneously didn't end up being an issue for us. In fact, I think it created a more relaxed environment and it gave myself and my fellow instructor, Brent McMillan, a chance to learn more about each other's teaching styles. So one thing that I would say emerged as a result of the space was our weekly huddle in the X-ray lab at the first 15 minutes of every lab on a Thursday. We also generated a few other activities such as the MRT week parade and elevated a couple activities that we had already been doing in the Wilna Thomas building, but now just with a new possibility for how we could facilitate it given the new spaces that we had available to us. So our weekly huddles was something that just kind of naturally came about with the way the space was designed and also just the way our scheduling worked. So I would say Thursday labs are critical for our students because this is the supervised practice time that's mainly used as preparation for a competency assessment the following morning. So at this point in the week, students are also pretty tired because they've sat through lots of lectures. The labs usually happen later in the day. Stress can be high. So I found the huddle helped set the tone for being productive, for resolving issues, for creating an atmosphere of positivity, and also to boost energy and motivate the students to work hard, even though this is at the end of their day and they're typically tired. So huddles are not new. I recognize they're used in a variety of health practice and education settings. However, I'd say that our new space was very conducive to this, which demonstrates how a change in space influenced how we facilitated labs. So we were able to have all instructors and students in one place, at least those involved directly in this course. And there's so many different elements to the course with a couple different instructors teaching different labs and a couple different lecture components. So it was really nice to have all of us together, being able to huddle. And we also started inviting others to participate, such as newer MRAD faculty, just to check out what was going on down in our area. We invited a couple of the new sonography instructors to give a window into how we facilitate our labs. And also once in a while we brought in guests from the hospital. So activities that was suggested during our weekly huddle was the MRT Week Parade. Like many other health professions, MRTs have a week that's celebrated nationally. And I think this space was inviting for the students, meaning the building was inviting for the students. It was the collective energy and excitement that really drove this activity, and the students felt like they really wanted to go around the building and showcase themselves to the other programs. So during our parade, we set up a few demo portable x-ray scenarios where we recruited students from other programs who just happened to be hanging out in the various student areas around the building, which never would have been possible where we were before, or it would have been a lot more limited in the Wilna Thomas wing. So I believe this was beneficial on many levels. It created team spirit, pride in the profession, being able to promote our program's enthusiasm and contribute positively to the MRT culture. It got students excited about their future chosen profession, gave them a little bit of a break in the term, given that they had had midterms and lots of exams going on prior to that, and also just to spread the word to others about the work of MRTs, which is what the week is all about, self-advocacy. So I've got a couple more events that I'll run through quickly here. So we do an event called our Intercohort Learning Activity Day, and we also have a potluck that goes along with that. This event was started 3 or 4 years ago by MRAD faculty, and our main objective is to help alleviate some of the anxieties and unknowns about what life will be like at the hospital placement. And our students go out to their hospital placement in the second term, so really we only have 14 weeks with them before they have to go out into this, what seems like a scary unknown environment. So essentially it's all about peer-to-peer mentorship, and the year 2 students who we invite to come in as the senior class also benefit because they get to see how far they've come in only just 1 year, and being the ones who the next class looks up to for advice and insight can give them a boost as well. Also, it's a really good potluck, so everybody benefits from having food and lunch. So although we always used to find a way to make it work, we had struggled with space in the past in our old Wilna Thomas labs. But this year I felt we had so much more space to congregate both cohorts and instructors, as well as external guests for a variety of learning activities. So it was a huge success once again. The last activity I'm going to talk about is something called Department Day, and this also started in the Wilna Thomas building at the Lansdowne campus. The purpose of this day is to give students a chance to apply what they've learned up to this point. We get them to work in pairs, and we ask them to make care decisions as they would in a real clinical setting. For MRTs, that means prioritizing procedures, planning an approach to the procedure that will be appropriate for the patient, given the information provided on the requisition, and many more tasks. We also task the students with being in charge of their own workload, as if they're on a clinical shift with a busy waiting room, and it allows them to find out how many cases they would be able to complete in the allotted time frame, and also have feedback from instructors kind of in a more relaxed setting where it's not a real patient on the table. It's a safe place to make mistakes, to try things out, and to receive feedback from an instructor as well as peers. So I think there's the potential to make this an interprofessional activity, incorporating students from other programs. There's also an opportunity for us to use the teaching clinic and set up an experience where students are able to truly suspend disbelief and immerse themselves in the simulation of being in a hospital with multiple rooms and phone calls and having to go do portables and having to get patients from a waiting room like setting and having a registration and possibly having all of those elements that go along with privacy and confidentiality and documentation and interprofessional collaboration in a healthcare setting. So I'm dreaming big about how this day can evolve into something more in this building in the future. So in summary, the 3 words that I would use to describe the CHW learning spaces are collaborative, vibrant, and welcoming, especially for students. I believe we were able to elevate all of the activities we'd already been doing and add some new ones. One thing I learned is to embrace change and look for the potential in the new space rather than fear it. I think there's a lot of potential in this new building, and I look forward to finding out what ideas emerge from today's session. So thank you everyone for listening and have a great rest of the day.